And I'd like to welcome you all to our Thursday 1:30 p.m. session today with Tori, where she'll be talking about some changes to our bodies. And I really look forward to the session today. I'm going to go ahead and read our disclaimer before we get started. The WildTech DC Senior Digital Equity Program, its owners and presenters offer technical assistance, virtual health, well-being information designed for educational purposes only. You should not rely on the info and any apps or topics made by WildTech, including but not limited to mobile device applications and any social media pages maintained by WildTech, its owners, or presenters as a substitute for professional medical advice, diagnosis, treatment, or legal advice. Thank you so much for letting me read the disclaimer. If you cannot see us, hear us, or see the screen, please let us know in the chat. We'd appreciate that. Let's make sure to keep our TVs and cell phones in mind. And as always, make sure you take notes and or screenshots so you can review the information for later. But this session will be on our YouTube channel, so you can review and rewind as much as you'd like. Tori, if you could introduce yourself and your topic for today, we'd really appreciate it. We thank you so much for coming on.
Sure, thanks. So hi, everybody. My name is Tori. I'm an occupational therapist, and I work primarily with people in their homes to help them figure out how to manage some challenges that you might be having in your home. So whether that's making some changes to the home or using some equipment, talking about health and wellness. And I love my times coming to talk with all of you. I know a lot of you. I've been to some of your homes and, and I've gotten to know you all over the past couple of years. So thank you for having me. I do have a presentation to share too, so you know, Alex.
Oh, yes, Tori, you're able to, you're a co-host, so you're able to share.
Okay. Should I go ahead and
Mhm.
start now? Okay.
Mhm. While you pull it up, I'm sure you were aware, but did you know, everyone, that May is Arthritis Awareness Month? It was
All
actually
right.
founded by the Arthritis Foundation. It affects more than 53 million adults and 300,000 children in the U.S. alone. It's the leading cause of disability among adults in the U.S. So I'm not sure if you're going to talk about arthritis today in your session, but it definitely made me think of your session today
Mm,
because a lot of
that's
folks
so interesting.
are affected by it.
Yeah, a lot. That's true. That's interesting. Not specifically, but we're going to talk about bones and joints, so it'll come up for sure. So I'm going to share. I guess I'll go ahead and share the presentation now. All right. Everybody see that?
Yeah, you are good to go.
All righty. So I did, as Alex said, I did this talk. It was actually June of 2024. I can't believe it. So it's nearly a year ago since I gave this talk last. And I updated it just very little bit, but I had done a lot of research on it. So it seemed like it was still pretty relevant and up to date. Um, and I'm excited to do this talk because I think that as we get older, things start happening to our bodies and we don't understand what's going on, right? Like all of a sudden, for me, fonts, like things like to read things became way smaller. That was my interpretation of it. Not that my eyes had changed, but like everybody was writing things too small. And so I think that things happen to our body and we don't always recognize what it is because it's generally, if everything's happening in a somewhat normative way, it's generally pretty slow and subtle until one day you realize that, like me, I have to wear glasses to read things all the time now. So I wanted to share with you like what happens to our bodies as we change, as we mature, so that you know that maybe you're not going crazy, or maybe things are worse and you should have them checked out. So sort of like from both perspectives, so you kind of understand what's considered like normal as we get older. And I was thinking about this today, like, as we go through life, our bodies are changing all the time. It's not just as we get older. Like I was thinking about, and you can all tell me what you think too, like when you watch children develop, at some point, some kids will have growing pains. I don't know if you guys remember growing pains. I distinctly remember growing pains and how painful they were. And that's something that's just normal part of aging, of growing older for kids, right? And then, of course, puberty, all kinds of stuff happens then, right? That's happening to our bodies. And then you sort of reach a plateau and then things start changing again. So it's just the evolution of our bodies, is really the way to look at it. So, all that being said, there's a lot of words. You know, I usually talk to you guys, I like videos and pictures, but there just didn't seem to be a good way to do it. So, I made this into a document that I shared in the chat. So you don't need to write anything down unless you want to. And I'm not going to read every word on in the slides. I'm just going to highlight what they say. But I'm going to stop at certain points and see if you have any questions about where we're at and make it as interactive as possible. So it's not too boring. Alrighty.
Thank you for the PDF, Tori. We really appreciate it.
Yeah, just because it's a whole bunch of information um, that I don't want you to have to be concerned that you need to understand all of it as I'm talking. What I have my own disclaimer for this particular talk because I am not a physician nor a researcher in this topic. So I got all of this information from the Merck manual. So the Merck manual is well, it's a textbook that used to be used in medical school training. I think it probably still is. And they do research and it's very scientifically based. So the information I got is from there. This is not me speaking. And if you, again, as we go through this, if things are happening to your body and maybe not explained by this, I always recommend that you contact your provider, your healthcare provider, and discuss it with them. So I just want to make sure you know that. All right. So what we're going to do is we're going to go throughout our bodies. We're going to go system by system and just talk about the things that change, right? So I started at organs. So organs are like your ovaries, your liver, your kidneys, the things that do just to keep our bodies functioning all the time. And your brain is also an organ, as is your skin and your heart. So we're going to go through all of those things. So as we get older, we start having a decrease in the number of cells in our organs. So it doesn't mean that anything bad is going to happen because actually we have a more than enough. We have an abundance of cells and things. So even with any sort of decline, our organs are designed to last regardless of how our aging goes within reason, I imagine. I don't know, at some point, if science brings us to aging to 200 years old, I don't know if that's true, but at the moment, we are born with what's called a functional reserve. So even though things are changing and you don't have quite as much cell reproduction and growth as you did when you were younger, it's still okay. So for example, even the liver, as you know, you can live with half your liver because some people will donate parts of their liver to people. So if things are happening to your organs, the important part of this to know, like if you start having significant problems, often that's more associated with like an actual disorder versus just aging alone. So for example, if we're thinking about the kidneys, I'm guessing some of you are familiar with people who might have chronic kidney disease. Unfortunately, that's often due to things like maybe diabetes or other sort of conditions that will affect your kidneys. But your kidneys on their own are not going to become dysfunctional just because you're aging. So hopefully that makes sense. And we'll keep going and then I'll see if you have any questions after the next couple of slides. Um, okay. So bones and joints. This is where a lot of things become pretty important for what I do, right? So as we get older, our bones tend to become less dense. So I'm sure that a lot of people, particularly women, as we age, that our bones, we are more vulnerable to osteopenia and osteoporosis, which means if we fall or do something, we're at a higher risk for fracture. But this happens whether or not you have osteopenia or osteoporosis. Those are just sort of the extremes of this happening. So all of us, like our bodies are not absorbing calcium the same way it used to. We're not absorbing vitamin D. Like there's all kinds of things that are happening that our bones are not quite as strong as they were when we were younger. And the most vulnerable bones are your leg bone, your thigh bone, your wrist, and your spine. So you want to be very careful. Again, we've talked about this before about not falling on your hip, not falling on your wrist. The spine is interesting. I don't know if you guys know, but oftentimes people will be diagnosed with what's called compression fractures. And that's literally just where your bones are to a point where they just start to collapse on themselves just from gravity. And that's a thing. So our bones definitely become less dense and less strong as we get older. Um, And then the cartilage will also become thinner and your joints are going to become stiffer. So this might lead to osteoarthritis, as you were saying, Alex. It does actually come up here. So arthritis is a condition of the joints, and it's not something, I guess you, as you all know, that we can easily reverse. It's something that you have to sort of learn to figure out how to manage the symptoms of it. And we can talk a little bit about that. Um, but unfortunately, our joints are changing and our cartilage is changing and things become stiffer and a bit more rigid and a bit more brittle. So I think I've probably used this analogy with you before when we've talked about making sure that you try to stay as limber and flexible as possible so that you can withstand like any change in your balance or something like that. So if you think about like a little sapling tree versus like you know, an older, more mature tree, you can see the difference in how flexible they are, right, at their trunks. So it's very similar for us. So I'm going to ask you my first question. Do you remember from my other talks, and I might have already given it away right now, but do you remember from my other talks what is a very important joint to keep flexible?
Any takers? Raise your hands.
And Alex, I'll let you monitor this because I can't see the chat and stuff.
Yeah, I got you.
Okay.
Um, yes, any takers? What is an important joint to keep flexible? Please raise your hand. We got Anne. What do you think it is?
Your knees?
Your knees are important, but that's not the one I'm going for. But yes, I should say all joints, of course, are important, but that's not the specific one I'm going for. But thank you.
How
That,
about you, Miss Celeste? What do you think?
I was going to say the knee simply because I had knee surgery. So I was going to say the knee.
It's not that the knee is unimportant. It certainly is very important to keep flexible, but there's one that's even a bit more important in regards to, let me put it this way, let me give you a little bit of a hint, in regards to reducing your risk of falling.
Reducing your risk of falling. Anyone else would like to take a gander? Okay. How about you, Miss Brenda? What do you say?
I say your ankles.
Yes, you remember?
Yeah,
I know that's
Yes.
right, Brenda.
yeah,
Brenda's heard me talk a lot, I think.
yeah, I have.
Yes, your ankle. So I think I was thinking I kind of given it away with the tree example, but so imagine if your ankles are really stiff and rigid and you know somebody bumps into you. You don't have the flexibility in your ankles to kind of have your body sway just a little bit to avoid a fall, right? If you're super stiff and somebody bumps you or you bump into something, whatever happens, there's a greater chance you're going to fall over. So keeping your ankles as flexible as possible is really, really important for reducing your risk of falling. All your joints are certainly important, and I don't mean to dismiss the knees, certainly, but with specifically with regards to fall prevention. And that's where I think I've told you guys to pump your, you know, to pump your ankles up and down or write your name with your toe and all that stuff. So please keep your ankles as flexible as you can. Thank you. Okay, let's talk about muscles and body fat. So you may already know this just from your own body, but as we get older, we sort of lose some muscle mass and some muscle strength. This is normal. It starts to happen at the age of 30, so it starts to happen pretty young. You know, again, imagine the little kids and the growing pains and the puberty and all that, and then you sort of hit this plateau and you start going the other side of that. So it happens, but the good news, and I'm going to highlight this a lot, is that it can be partially overcome or at least significantly delayed by exercise. So even though this is what's happening to our body, we can certainly decrease its impact on how that affects our ability to function. Um, so really, you don't really lose, if you look at that statistic, you only really, just by normal aging, you only lose about 10 to 15% of your muscle mass. That's not really a lot. So any loss of strength or muscle mass beyond that is preventable by exercise. So if you're only 85% as strong as you were when you were 20, that's great, right? Like that's a great place to be. So I hope that what you get from this talk today is that a lot of this is not inevitable that there are definitely things we can do, right? So, in addition to the strength of your muscles, this is a little, I want to make sure I explain this correctly to you. They everything moves a little bit slower. We all move a little bit slower as we get older, right? I think you probably already know that. But that's happening inside of our bodies as well. So even the muscle fibers are not contracting as quickly as they did when we were in our 20s. What does that mean? It means that you're maybe not going to react to something or get to something as quickly as you did before. And this is where that idea of mindfulness comes in. And I've spoken about this in the past too, but being aware that maybe your body isn't quite as quick or isn't doing things quite the way you used to do before, and just being aware of that and planning ahead and taking your time, it's fine to do that. And just know that that's just part of what's happening in our bodies. Again, regular exercise is going to help. And it doesn't matter when you start. People who have never exercised can still increase their muscle mass and strength. So it doesn't matter what age you are. I don't know if you guys have seen, like, sometimes there's videos or stories about people who started running marathons and doing all kinds of intense athletic things at age 70, 75, 80, and it's done. It can be done. So I'm not saying that that's what you should do, because I'm not going to do that. But don't be discouraged if you haven't been a regular exerciser in your life. It's never too late. But conversely, inactivity is really, really detrimental to us, because with inactivity, we lose muscle mass faster than young people do. So if you've had some sort of illness or surgery or hospitalization, whatever it might be, you'll probably feel the effects of like being on bed rest for longer than you did when you were maybe 20. Like you might have thought when you were 20, you could get over the flu or get over a cold and like, snap out of it and get right back to your routine. Whereas it's not quite happening the same way now. And that's common. That's what's happening. So really try to minimize your inactivity. Of course, we get sick, so I mean, it's going to happen. But when it does, just be very aware that you're not necessarily yourself even after your illness have you recovered from your illness, right? Just be very mindful and very aware of your body for a while until you really feel like you're back to yourself. We also have more body fat as we get older. And so, of course, there can be concerns with body fat and its health risks. So again, healthy diet and regular exercise can help with that as well. Okay. You know what, Alex, I'm going to stop here and just see if there's any questions about that first before I keep moving on, about what I've talked about so far.
Thank you so much, Tori, again for this presentation. I love the bit about the organs. We've had a organ donation group on, and that bit about the liver, it just made me think about that. And
Mm,
well, it makes me think our body are so fragile but so strong at the same time. So we just
totally. Yeah.
recognize what part we're working with.
Yeah, exactly.
Like here, eyes, that's eyes versus something else could be, a whole different league of its own. So
Yep.
thank you for breaking everything down.
Yeah.
We got Anne, and then we got Miss Celeste. But any other questions, please put in the chat or raise your hand. Okay, first up is Anne. Thanks so much.
Tori, you mentioned body mask.
Yeah.
What can you do other than exercise mainly? Is that the main thing you can do to strengthen your body, your muscles?
Well, yeah. So yes, definitely exercise is important, as is a healthy diet. So if that's something that you are not doing on a regular basis, where I would start with your doctor and have them like talk to you about like a healthy diet for your particular body, because it may be different than everybody else. And then
Mm-hmm.
maybe if you're not a regular exerciser, maybe even just see if you can do a quick episode of physical therapy and get started and see what's comfortable for your body.
Okay, thank you, Tori.
Yeah.
Thank you, Anne. Appreciate your question. We got Miss Celeste next. You have a question about something we've talked about so far? And then we have Miss Brenda after. Love. That was my bad, Miss Celeste. Let me do that again for you. 1 second. All right, try now.
Okay, can you hear me?
Yep.
Mm-hmm.
Oh, I was gonna just have a comment. Exercise is important, especially as you get older, because I find by me doing my exercise, it helps a lot, especially as far as balance. But exercise and keeping moving does help,
Mm-hmm.
especially. And you mentioned about not moving as quickly as fast. I find that also true too, as you get older. But
Yeah.
thanks.
Yeah, thanks for sharing. Yeah. Yeah, it's true. And exercise is going to come up in pretty much everything for the rest of this talk as well. So it's so important for us. Yeah.
Yeah.
How about one more and then we'll keep going?
Yes, thank you so much, Miss Celeste and Anne, for sharing. We got Brenda. You got a question for Tori?
Yeah. Now, Corey, I don't do very much exercise, but I keep moving. I do housework and, I try to do those sort of things to keep myself moving. So, even though I'm not on a strict regimen of exercise, would that be considered exercise? If you're
Mm-hmm.
doing housework and
Mm-hmm.
sweeping, mopping, and,
Yeah.
okay, I'm good then.
Oh no, my yeah was I understand your question, but
Oh, okay.
my answer is gonna be no.
Oh, okay. All right.
Um, it's yeah, and that's great because it's keeping you active and
Yeah.
it's definitely great for you, of course. But so we're going to talk about it in a little while, but I'll give you a preview now. Is that really to be well, the ideal, and of course, we're not always going to hit the ideal, but the ideal exercise is a combination of things. So it's a combination of cardio, so you're doing something to get your heart rate up, which might be happening when you're cleaning. It could be
Okay.
happening. Um, Definitely strengthening though, and doing some sort of strengthening, whether it's with your own body weight or actual weights, and balance and flexibility. So some stretching and some balance exercises. So really you want to try to do a more holistic whole body program rather than just one thing. And
Okay.
yeah, and that's where you can, again, I'm going to encourage you all many times. There's no problem, even if you don't think you need physical therapy, but if you have questions about exercise or something in your body, it's covered by Medicare. You can go to 1 or 2 sessions. They can prescribe very specific exercises for you, and then you can keep going. It's certainly something that is good because it can be very individualized to you, and you can find out what you're comfortable with and what your goals are. So,
All right. Thank you.
yeah. Okay, we're going to move on to our eyes. And I don't think this is going to come as a surprise to anybody that, of course, our eyes change, right? Like, as I mentioned, how everything seems like it's written smaller these days to me, but of course it's not, it's my eyes. And the reason's because very similar to what's happening with your cartilage and other sort of soft tissue in your body, things are just becoming a little bit more stiff, a little bit denser. They're not moving as quickly. So like our lens in our eyeball is actually becoming less elastic. So it's not accommodating to changes in lights. We have less fluid, we have less nerve cells. So all the things that are happening throughout our body are happening in our eyeballs too. So, and there's nothing, unfortunately, we can do about that. I do think that some optometrists have said that you should be wearing sunglasses your whole life. And I think I've already like not done that long enough, but I try to wear sunglasses now, to protect my eyes. But really, other than a healthy diet, there's not a lot we can do for our eyes. But as they change, what we might lose is we might lose loss of near vision because again, you don't have that elasticity to accommodate to the smaller font sizes, to different lights. We need brighter light. We may not see colors the same way. We may not see depth the same way. So this is all normal. This is what happens to our eyes. Um, One thing to be very careful about is because things are happening more slowly, you have to be very careful when you're going from a dark space to a light space or vice versa, from a sunny space to a dark space, because our eyes are not adjusting as quickly as they used to. And you might just even for a split second be temporarily blinded as your eyes are trying to figure out what's going on. So take your time when you're going from outside on a sunny day to a dark building, vice versa, a dark room in your house to a bright room in your house. Be very mindful of that, that you just need to give yourself an extra couple of seconds to accommodate to that. Um, and, we're also going to have even the signals that transmit to our brain are changing. It's not just your eyeballs, but it's actually so, as your eyes see, right? Your eyes are like what are seeing things, right? But then there's nerves that conduct the signals to your brain to interpret what's going on. And even that's slowing down a little bit, like the speed of those signals. So sometimes we'll have more difficulty with depth perception or judging distances and things. So again, nothing, we can't change what's happening in our brain as far as the speed of our nerves and all that, but we can just be more aware and more mindful of that it's happening. You might see floaters. A lot of people see floaters. That's pretty common. You might have dry eyes. That's also very common. And really, the best thing you can do for this is to have regular vision exams at least once a year. Some people have it twice a year. Of course, if you have any specific condition like glaucoma or macular degeneration, you would probably go more often, but you would work out with your doctors. And then also just even the appearance of our eyes, like they may turn a little yellow or they might have splotches or other things. Of course, if your eyes are turning very yellow, we all know that that's a problem with your liver. So please get that checked out. But once you have it checked out, if you still have like a little yellowish tint to your eye, it can be normal. Even our eyelids, just over the effect of gravity and less elasticity in our skin, our eyelids might droop. Our eyebrows might droop, all kinds of things are drooping and doing stuff because of gravity. It happens with our eyes too. All right, so let's move on to ear, nose, and throat. So, of course, hearing, we're going to talk about hearing, a progressive loss of hearing. So really the beginning, typically for most people, of loss of hearing is high-pitched sounds. And the funny thing is, so my girlfriend, who is my age, she's dating a man who's a little bit older, and he's constantly not hearing her. And she thought like he was just ignoring her. It turns out that it's because he really has a loss of high pitch, and she has a very high pitched voice. So he wasn't actually really ignoring her. He really couldn't hear her. Um, and I don't think you necessarily know that because you can hear so much, there's so much you can hear that you don't realize that you're missing the high pitch stuff. So it's important to know that and get that checked out. Other common things that happen as we get older, we can get a greater accumulation of earwax. There's sometimes benign or non-cancerous tumors we can get in our ears. Even certain medications might affect our hearing. So very important that you are getting your ears checked as well, either starting with your primary care provider and then have them refer you on if you're having problems. And so the other part of losing your hearing is that it becomes harder to understand people. And again, I don't think I'm telling you something you don't know. And that's again going back to this idea of like high pitched sounds are difficult to hear. So apparently, and I learned that from doing this talk, but consonants are more high pitched than vowels. So when somebody's talking, you may not be hearing the consonants, you're only hearing the vowels, which makes them sound like they're mumbling. Which can be frustrating for both you and the person who's talking because you're not understanding them, right? So just be very aware of that. It's just your ears and this is what's happening. And you can just ask the people around you to articulate a bit more or to just speak a little bit slower. So, it's going to be hardest, of course, with women and children who have higher pitched voices. So you just want to be aware of that, and hopefully you'll have a kind family around you that understands that, or you can go to see an audiologist and see if hearing aids are appropriate. I'm going to keep moving on, and I'll stop after I think the next system, okay? Another part of your ears, of course, in addition to hearing, I've spoken about this before, but your inner ears are important for balance. And so you have these bones in your ears that help you with balance. And so if there's any problem with like dizziness that you can't explain, it might be an inner ear problem. And this is absolutely important that you talk to your doctor about any of that kind of stuff, about vertigo, ringing in your ears. All that stuff is important that you talk to your doctor about. Now, let's go on to the nose. Our sense of smell declines as we get older. And so sometimes this is why food doesn't taste the same as it did when we were younger, because as you know, your sense of smell is very much impacts your sense of taste. And so I think a lot of times that's what contributes to a decrease in appetite, because food just doesn't taste as good anymore. It's very bland. And our taste buds, of course, decrease too. So you've got a combination of your sense of smell is going away, your taste buds are getting less sensitive, and so food's just all of a sudden not tasting so good. So a lot of nutritionists will recommend that you use more herbs and spices, not more salt, because probably all of us have to be careful with salt and sugar, but more herbs and spices to really make your food more tasty so you don't have a loss of appetite. A lot of older adults start liking spicy food as we get older, where if you didn't like it when you were younger, because it's more palatable as we get older. Now your mouth, you have less saliva as we get older. So you want to make sure you stay really hydrated as much as you can, but you're going to have less saliva. The challenge of that is that then your teeth, unfortunately, become more susceptible to bacteria. So you want to make sure that you take care of your dry mouth, you talk to a dentist about it, you get regular checkups and do really good oral care, because in bad or poor oral hygiene really can have some really devastating consequences if you have bacteria in your teeth, as you may know. So be aware of your dry mouth, talk to your dentist about it, get regular checkups, make sure everything is okay there. I saw a hand raised, so before I go on to skin, were there some questions there? I know hearing might be a big one.
Again, thank you, Tori, for the topics today. I was glued to the screen. You talked about eyes, ears, nose, and throat, all of our senses. So a lot of things affect other things. So we got to take a holistic approach. So I'm glad you're going over these things. Um, I think yes, we did have a hand before. Um, if you had a question, yes, okay. Thank you so much. We got Ms. Doris first, and then we got Mr. Adams.
I wanted to mention this about your eyes. Okay, I just recently was in the hospital, and every morning when I wake up, my eyes would be bloody red. So I was taking the Zyrtex pills. When I was in the hospital this time, they gave me the liquid Zyrtex. And I don't know what the difference is in the two, but since I was on that, my eyes aren't red anymore.
Huh.
What's the difference in the pill and the liquid? Do you know?
I do not know. No, that's really interesting. I have no explanation for that.
Yeah, because I was using Lumify every morning to get the redness out. I don't have to use it anymore. I'm trying to figure out what is the difference.
That's so interesting. If you get a chance to ask your provider, please report back to the group, because that would be interesting to know. I have no idea.
Okay. All right, then. Thank you.
Thank you.
Thank you so much. Again, any questions you guys have about anything Tori has chatted about with us so far, please raise your hand. We got Mr. Adams, and then we got Miss Celeste after that.
You mentioned it already when you was talking about the vertical part. I just wanted to touch up on it a little bit, that if it should happen, like the way my doctor explained it, when you get up in the morning, don't get up real fast, because that was, going. Also, if you have someone with you and it does come on, get them to lay you on your back with your head off the bed real fast, and then turn your head to the left or the right for about 30 seconds. And they can see in your eyes, your pupils move. That's letting them know that the crystal that are in the back of your ears has gone back into a slot. And it helped me, because I suffer from vertigo a little bit, but since the doctor told me what to do, I haven't had that problem anymore.
That's great. Yeah, that's great. Thank you for sharing. So yeah, you can go, I don't know where you learned it, but there are physical therapists and speech therapists that specialize in vestibular rehab. And so depending on the cause of the vertigo. So what you're talking about with the crystals in your ears, I know speech therapists do it, and I think and physical therapists both can do it, where you do various head movements.
Rehabilitation hospital.
Yeah, yeah. So yeah, if you have vertigo and you can ask your doctor to do some vestibular rehab, they can teach you and your family, your caregiver, whoever's around you to help you do those techniques to try to resolve it if it's caused by that. So that's a great tip. Thank you.
Thank you, Mr. Adams. Yes, I think the main thing that I got from what you had shared was you went and got help. You asked and you got that help. So,
Yeah.
kudos for that. I love that. We got Miss Celeste. Do you have a question about something we covered so far?
Yes, thank you, Tori, for talking about the eyes because I noticed my eyes have really turned in different directions since I'm older. And I do have glaucoma and it's not fun. So when you have to take, the good thing about it, I don't have any dark pupils. My pupils are bright. So,
Okay.
but thank you for mentioning that about the eyes because I have glaucoma and I'm having cataract surgery next Monday. So
Oh boy.
I
Mm,
did go back and, check with the doctor. Keep checking
Yeah.
with the doctor.
Yeah, yeah. And the eyes are, like I said, all of those systems, your eyes, your nose, your mouth, your ears, those are not things that we can easily rectify on our own, like by doing exercises. So those are things to be aware of and to be followed by providers,
Yeah.
definitely, and just be mindful. Yeah.
Yeah.
All right. Well, let's keep going.
Thank you, Miss Celeste. Good luck with everything.
So next we're going to talk about the skin, which, and if you remember from grade school, it's the largest organ in our body. But so as we get older, our skin, with everything else, becomes less elastic. I'm sure, again, that's not a surprise to you. Becomes a little bit thinner. We might be more susceptible to tears or lacerations in our skin. We might be less sensitive to pain, temperature, and pressure. So I think the important part of this to be aware of is just to be really careful of what you do with your body and what your skin's exposed to, making sure that you're watching it when you are preparing meals, that you're not putting yourself at risk of scalds or burns or cuts and things like that. So it's nothing we can do to improve it, just be aware of it. This is interesting. So, a lot of times they talk about how older adults are more susceptible to temperature, particularly heat stroke. And a lot of it is because the number of sweat glands and blood vessels at the periphery decrease. And so, you know, the sweat glands, of course, are important for helping our body dissipate the heat, right? As well as the blood, as blood flow. So, as that starts to slow down, we're not going to be able to cool ourselves as quickly as we used to. And so we're more susceptible to heat stroke. So just be very mindful of that. That's just part of what's happening inside of our bodies. So when they say in the morning that I think they have, like, whatever they call it, like an orange day or a red level day or something like that, take it seriously because it could be dangerous. And heat stroke is something that can happen so quickly. You just all of a sudden it comes on you. So just be very careful of that. And of course, also when you have decreased blood flow, things are going to heal a bit more slowly. So again, just trying to prevent cuts and burns and things to your skin. We're also less protected against ultraviolet lights because we don't have the chemical, the melanocytes that protect us from the ultraviolet rays. So you want to be careful of being out in the sun too long and watch out for any spots. Make sure you have a dermatologist take a look at anything that you're concerned about on your skin. And the other unfortunate thing, because vitamin D is so important, our body is less able to absorb it from the sunlight like we used to be able to. So it's really important to talk to your physician about your vitamin D levels and if you should take any supplements. I wouldn't recommend just starting it. Definitely talk to your physician first and get your levels pulled. Okay, so let's talk about the brain and the nervous system. So our brains are, as you can imagine, very complex, and I don't think most even neuroscientists and neurologists, they even know a tenth of what really happens in our brains. They'll be the first to admit it's complicated, right? What we do know, some things though, We do know that the number of nerve cells decreases, but that's again not a big deal because our brains are able to make new connections. So even as we get older, things can rewire in our brains. It's called neuroplasticity. So you might have experienced that or know somebody like maybe somebody who's had a stroke or something like that, and where initially they can't move something or they can't speak or something's happening, and then they're able to recover a little. It's because potentially the brain has rewired and gone to a different area so that they can regain some of those skills. So it can happen at any age. And our brains are pretty phenomenal at that. And really keeping your brain healthy is super important. It's as important as keeping your muscles and your bones and your joints. And I'm sure you've had a bunch of people talk to you about that, different types of cognitive exercises you can do. But please take it seriously because it is something, if you don't use it, you lose it, works for your brain as well. And actually what they find is for brain health, and I'm probably repeating something, but that's okay. For brain health, you're not only going to do like cognitive tasks, like maybe puzzles or learning something new, but also physical exercise helps with your cognition. So it's, again, physical exercise is important for that. The good thing is as well, as with our organs, we have redundancy in our brain. So we have more than enough potential brain power to accommodate for things that we're losing. So know that your brain is there to support you for as long as we live. You got to take care of it. Okay. You got to take care of it with diet and exercise. And this is something you may notice. So you may notice that as you got older that sometimes, again, we're talking about the messages that are sent in your brain. Things are not moving as quickly, maybe. So maybe like you have a word at the tip of your tongue, or there's something that you've known forever, and all of a sudden you just can't recall it in that second. It's okay. Like these things are going to happen. We're just going to have a little bit slower recall. It's okay. The important thing, as long as you're able to still, maybe it'll come to you slowly, or you can still do the things that are important to you accurately. It's fine. It's just part of what happens. When it becomes more problematic and you're, really forgetting things, or you're not able to safely do things in your home, that's of course when we're talking about more things like dementia, and that's a whole different story. But just sort of like, doing things a bit more slowly, or recalling a word a couple of seconds after you want to use it, it's very common. So just wanted to let you know that. And again, a lot of this is because everything is just slowing down. The signals are slowing down. Blood flow is slowing down. This is also happening. So, your brain and your spinal cord are your central nervous system. So the changes that are happening in your brain are also happening in your spinal cord. Good thing is that usually this doesn't make much of a difference to us at all, other than things moving a bit more slowly. So, but it's pretty minimal, and really changes in our spinal cord, they're fine unless there's a specific reason for a damage, like you have a pinched nerve or a collapsed vertebrae or an injury. But other than that, luckily our spinal cords seem to function just fine. So let's talk about our hearts. So for an interesting reason, our hearts tend to enlarge slightly when we get older. This is not necessarily a good or bad thing. It might result in our hearts, the walls becoming a bit stiffer, which means that we don't get as much blood in each of the chambers happening. So things are changing in our heart, just like they're changing everywhere else. You could have age-related stiffening of your heart walls, which means that basically like things are not filling up as much or not moving out as much. Of course, there are a lot of diseases that will make this a lot worse, right? So things like high blood pressure, obesity, diabetes, any type of cardiac disease. This is very important, as you know, like that you're followed by your doctor and your cardiologist, because these things are manageable with medication and lifestyle changes, hopefully. So there is a level of normal aging to your heart, and then there's a level of disease and disorder that you have to have managed. During rest, so generally our heart is still doing the same thing it's always done, right? But our heart might beat a little bit slower as we get older. And that's normal. you know, again, if you feel like it's too slow, if you're tired all the time, fatigued, you have swelling anywhere, things like that, definitely talk to your doctor. So, and I think you probably know this too, but in regards to elasticity of our tissues, just like with every other tissue in our body, our blood vessels become a little bit less elastic. And so that they're not able to respond quickly to changes in blood pressure. And that's where a lot of times as we get older, we have high blood pressure because we just don't have the elasticity. There could be other reasons, but that's one of the reasons is that we don't have the elasticity in our blood vessels. And as you were mentioning, Mr. Adams, the orthostat, oh, I gave it away. I have a question. When you are going to stand up, so if you don't have vertigo, but still when you stand up and you get dizzy, a lot of that can be accounted for because our vessels are not as elastic as they were. And so they're not able to accommodate for you changing from sitting to standing quickly enough. And you might get dizzy. So that might be one of the reasons. Once your doctor has checked you out and determined that there's nothing wrong with you and you still get that dizziness, they're going to tell you it's just normal, and it is. And there's a term for it, which I think. So I'm going to see if any of you remember. I almost said it, so I might have given you a little hint. Does anybody remember what the name for this dizziness is as we change positions? So when you go from laying to sitting or sitting to standing. And if you don't remember, that's okay. But
Anyone want to take a gander? What is the term for that dizziness as we change positions? All right, Miss Louise, what you got for us?
And I don't know which one she's looking for, but there's vertigo and there's orthostatic hypotension when you stand up suddenly.
that's right. You're right. Though I was going for the orthostatic hypotension. Yes,
Yeah.
that's the one. Yep. So that just means though you get a decrease in your blood pressure. Yeah. Thank you. That's
Good
great.
job, Louise. I know that's right.
So for either Miss Louise or anybody else, so what do you do when we're talking about orthostatic hypotension and the doctor has said, you know, you're fine, you're healthy, just this is what's going to happen. What do you do to manage that?
Mhm. Well, if you all want a simple answer, it's that M word. So that's a hint for you all. Okay, all right, Mr. Adams, would you like to share? And then Louise after.
The question, the answer to the question is what my doctor told me to do was get up slowly,
Mm-hmm.
put my feet on the floor, take a few deep breaths, relax, and then stand up. And that should ease the tension and the hypertension and what have you that causes my dizziness. And that works also. Just take your time getting up first thing in the morning, or even in the daytime, you rushing or whatever. You just take your time and then stand up slowly, stand there for a moment, get yourself together, and then go ahead and on where you were going.
Perfect. Yeah.
I love that.
Yeah, that's exactly it, Mr. Adams. Yeah, perfect. Yeah, take your time. I think Alex was hinting towards mindfulness. Yeah, be mindful of your body and how you feel before you move. Yeah, and whatever you need to do to make sure that you're feeling good. Yeah. And I know this is hard for us. It's hard for all of us. We've all led busy lives, with children and jobs and chores and life. And, you just used to multitasking and doing stuff and running around and answering the phone and this and that. And it's a behavior change. It really is. But it's important because if you just change that behavior a little bit, you're making yourself less vulnerable to consequences, right? Thank you. That was perfect. All right. Let's keep going.
Did you want to see if there's questions, or do you want to keep going for the heart and then questions?
Let's keep going.
Okay.
We got the answer to those. So again, your heart and your vessels becoming less elastic. We've talked about you can have cardiac conditions, you can have hypertension, all this stuff. Like this part is very important that you just talk to your doctor about this, as you know. Like these are just more things that happen as we get older with blood pressure and heart. But again, assuming that you've been checked out by your doctor and you don't have anything particular going on, any particular diseases, and you're cleared by your provider, exercises are so important again on the aging, on the effects of aging on your heart and your blood vessels. So as I was saying, Miss Brenda, this is one of the things. So in addition to being to working on strength training, doing some sort of cardio training is important. And trust me when I tell you, it is my least favorite thing to do. I don't like sweating. I don't like getting my heart rate up, but it's important. And you don't have to sweat. You don't have to do, aerobics. You don't have to do there are things you could do. And this is where again I would consult with a physical therapist, your doctor, maybe a personal trainer, wherever you prefer to get exercises and see what type of cardio works for you. In the end, I just dance. Like I literally just turn on music and dance in my house, and that's how I do like my little cardio every day because it makes me happy and I don't have to go running. Some people like to run, some people do speed walking, some people swim, bike ride. I mean, there's all kinds of things you can do. So, talk to a professional and see what your version of cardio exercises are. Okay. Let's keep moving on to the lungs and then maybe we'll take some questions. I don't even know how much longer I think I have more to go and I know we're getting late. Okay, so our lungs and our diaphragm. So our diaphragm is the muscle that's underneath that helps our lungs breathe. It's this whole sort of like vacuum system that's going on in our body. So as with all of our muscles and everything, the diaphragm is the muscle, as are the muscles in your ribs. You have muscles in your ribs that are called intercostals. So all of these sort of systems work together for efficient breathing. So all of them, unfortunately, become a little bit weaker and a little bit less elastic. So our breathing is maybe slightly more difficult. It shouldn't be significant. It really shouldn't be something that you notice significantly. And if you do, absolutely speak to your doctor about it. But just know that these are things that happen. And particularly, it may become important to consider, though, if you have a respiratory illness and particularly pneumonia, and why, as we get older, we're more vulnerable to pneumonia and its consequences. And if you're going to go hiking in any high altitudes, just know that might be a problem. And again, our cough may be a little bit weaker. Our alveoli may not be able to get out the microorganisms fast enough. So, be very, very mindful when you have a respiratory infection. If you're not feeling right, if you feel like things are not clearing, please see your doctor to have them listen to your lungs, because you want to get on antibiotics if you need them. And as with everything else, our digestive system is a little bit slower than it used to be. Mostly, as far as like getting the food from your mouth and through your system, it's going to be less, it's going to be pretty imperceptible for the most part. Things are still moving. Fortunately, gravity is working in our favor in this particular system. So it shouldn't be something that you're noticing as far as the speed becoming any slower. But things, of course, happen as we get older. So one thing that happens is we produce less lactase. So if anybody's had problems with dairy intolerance as you've gotten older, that's pretty normal. You might have more difficulty with constipation because things are moving a little bit more slowly. Our liver, actually, as part of the digestive system here, is becoming a little bit slowly. Sorry, a little bit smaller. And what's important about that, as you know, your liver is what's helping to filter medications. And if it's not moving quite as quickly as it was because it's not as small, it's getting smaller, the side effects of medications may last longer. So just be, again, very aware of the effects of medications on your body and talk to your doctor if you're feeling like the side effects are becoming or lasting longer or becoming more troublesome, more noticeable. It just might just be that you need to just adjust it. Our kidneys become a little bit smaller, again, just decreasing all that. We are more likely, more prone to dehydration. But generally speaking, our kidneys are set up to be working well throughout our lives. So typically they're not something that fails unless we have some sort of disease that will affect them. But it's really important to keep hydrated. I've talked about that before in regards to fall prevention, how important it is to stay hydrated. And then our urinary tract I'm sure I'm not surprising any of you by this, that we can hold less urine in our bladder. Our bladder muscles may not contract as we would like them to, so we may get urine when we don't want it, not enough when we want it, is all kinds of those things are happening. So incontinence, all that jazz that we're all going through. So the important part of this is that, again, once you've been checked out by a provider and spoken to them about it, there's a couple of things you can do. There are physical therapists that specialize in what's called pelvic floor physical therapy. And so there are muscles that surround your bladder that, believe it or not, you can work on strengthening that can help with incontinence and can help with urinary issues sometimes. So that's one thing you can do. The other thing you can do is just make sure that you go regularly, particularly if you're dealing with incontinence, and, set up a regular schedule for yourself just to make sure that you're okay. Garments are things that people wear. It's totally fine. Garments have become much more discreet as we've gotten older. At nighttime, there's urinals, there's bedside commodes. So there's lots of things you can do to manage this. The one thing we are all more vulnerable to as we get older are urinary tract infections, and they are devastating. They can really impact your cognition, they impact your balance, they impact your strength. So be very, very mindful of anything that feels like it might be a urinary tract infection. And of course, for men, they have enlarged prostates sometimes, so that will also affect them being able to empty their bladder. So not being able to empty your bladder can really contribute to a kidney infection. And a urinary tract infection might happen from just not being able to clear away the bacteria quickly enough. Endocrine, this is your hormones. So we have a decrease in hormones. That, of course, again, is probably not a surprise. So decrease in growth hormone because we no longer need it. So that's where we're getting decreased muscle mass. Decreased levels of aldosterone is making dehydration more. So basically, insulin, unfortunately, is not working the way it should. So we might be more susceptible to blood sugar. Regardless of diabetes, we might be more susceptible to blood sugar changes. For the most part, these shouldn't be anything that are going to affect you, though, for the most part. Other than the fact that if you have diabetes, that of course is something, but basically just, again, diet and exercise is a way just to maintain a fairly healthy endocrine system that should work for us as we get older, even if it's just a little bit slower. I'm just gonna get a sip of water. Hold on one second. All right, blood. So we actually are producing fewer red blood cells, which is important for carrying oxygen. It's important for energy and as well as our immune system. So those things are producing or reproducing a little bit more slowly, which means that we're more susceptible to infections and things are just slowing down. So our healing process is slowing down a little bit. So we just, again, need to give ourselves a break and take care of ourselves and just know that it may take a little bit longer to recuperate from something. Now, that being said, vaccines are very important to help boost your immune system to things that, particularly like pneumonia, the flu, because as we've talked about, our bodies are going to be less able to fight those particular viruses. And because our lungs are becoming a little bit less elastic, like those sort of respiratory illnesses can be very devastating. So vaccines are something to really consider and talk to your doctor about. We've talked about that. And okay, I'm almost done. So overall, then I'll take questions. So overall, people who exercise are healthier than those who do not. And these are the things that exercise is going to help. Improving and maintaining the ability to do your daily activities, maintaining a healthy weight, prevent or postpone disorders such as coronary artery disease, cancer, diabetes, cognitive decline, and early death. This is straight from that manual. So these are just, as we talked about, so many things that exercise is important for. And as I mentioned, you want to do aerobic exercise to make sure you have got good endurance, strengthening, balance training, and flexibility. So you really want to try to make sure that you're doing a combination of these types of exercises to really be holistic and covering all your bases, so to speak. The fountain of youth. Research has identified 3 strategies that help people live longer: exercising, following certain types of diets, and we're not going to get into diet here, but talk to your doctor about it, and eating fewer calories. So please talk to your doctor about this, because research has shown that this can really extend our lives and have a healthier life. I'm gonna ask you these questions later, but I want to show you a picture of my mom, because I talk about my mom all the time. So that's my mom and my daughter. And it
Oh,
looks like my daughter is 6 feet tall, but she's not. My daughter's 5'4". My mom is 4'8". So I just wanted to show you, like, healthy aging. So we want to be there. We want to be there with our grandkids, right? And to share and have fun moments with them. So that's my mom that I talk about all the time. All right, I'm going to stop sharing and open this up, because I do want to ask a specific question. Okay. So I know there's probably questions there, but one thing I'd like, when you're asking me questions, if you can also think about it. Oh, and there's all my exercise equipment in the corner. What kind of things do you think that you feel like you can have an impact on? What kind of things can you do to change or to sort of mitigate some of the issues I've talked about with changes to your body, if that makes sense?
great question, Tori. Please raise your hand, you guys, if you'd like to respond to that question. And we'd love to hear your thoughts. So we have 3 hands. Thank you. First hand, Ms. Brenda.
Tori, I think I could probably do the chair exercises. That would help. I think that would be a good start. Yeah.
Totally. Yeah.
Yeah.
No, I agree. And I know that you've probably done a lot on this platform with other people, right? And so
Yeah.
the ones that I've shared. So yeah, absolutely.
And I have one other question I wanted to ask. Now, if you've dealt with incontinence for years, would the pelvic floor exercises reverse that symptom, the incontinence?
I don't know, but I think it's worth exploring.
Okay.
Absolutely. Yeah. And those exercises are easy. Those you do sitting down or laying down.
Right. Yeah,
So,
I've done them before. I wasn't consistent with it. So
yeah. And it's sometimes, and so I did them with a physical therapist a couple of years ago, and it's even more than just the Kegels. There are other things to do. So that's why it's good to see them, because then they can figure out like other muscles that are happening that are beyond even just doing the Kegels.
right. Okay. All right. Thank you.
Yeah.
Love that, Brenda. Thank you so much.
Mhm.
Can you share your question again, Tori, for the group?
Oh, yeah. So I had it on my slide, but let me see if I can remember what I was going to ask you guys. I didn't want to, hang on, let me see. My
Oh, no, I
question
love
was,
that. I love that, Brenda.
I guess my bigger question is, what behavior changes do you need to make based on what I've told you today?
Yeah, so just thinking about everything we went over today, we talked about just any maybe small but significant changes that you can make to help better yourself. And I love you all sharing again. You guys are so brave, and we really appreciate you sharing, because it helps out others, truly. So please feel free to share. We are here for each other. That's what Tori's here for us as well. So thank you. Just keeping the time in mind. We have lots of hands. I love it. Ooh, I know that's right, you guys. Making me excited with all these questions and comments. But again, what small changes are you going to make as a result of this session today? We got Denise and then Miss Celeste.
Hi, how are you?
I think good. Thanks.
Good. Yeah. Well, change that I do, like you say, I do some dancing, put some music on. That's not hard at all. And then I have my bathroom upstairs. So I have to constantly go up and down step to the bathroom. And then when I'm sitting on the couch, sometimes I just be sitting here, I just jump up and go look out the windows, just to move, although doing housework. But them my changes that I do. Because putting on some music and dancing, it could be gospel music, any kind of music, jazz, whatever. Long as you moving your body or something, patting your feet, you know.
Totally.
Yeah, that's my changes. Uh-huh.
Yeah. Well, thanks for sharing. Yeah. Yeah. And I like the idea of getting off the couch. That's actually a really good point. I'm glad you said that. I've heard people make recommendations that if you're watching a TV show, every time a commercial comes on, to stand up.
Mm-hmm. And
'Cause-
some people say they go wash some dishes real quick while commercials on, just to
Yeah.
move their body or move around, you know?
Yeah. Because, yep, inactivity is so harmful for us. So that's great. Thank you.
Yeah, thank you for letting me share.
Thank you so much. Yes, any new changes as a result of our session today? Anything that you were inspired by our session today? We'd love to hear from you. We got Miss Celeste and then Miss Louise.
Hi, Tori. All those were good. They were very interesting and good for me. But for me, because I'm in my 60s and I do water aerobics. And for the heart, cut out processed meat and fried foods, which I love fried foods, but cut out processed meats as well. That's damaging to the heart. But the water aerobics, I love it.
Yeah.
That
Yeah.
that that keeps the heart going. It's tiresome, but it keeps the heart and helps the knees. So that's good exercise for me.
I hear you. Yeah. And I'm glad that you said that like that because I think and I'm glad so like there's two of us that like dancing, you like water aerobics. It can be anything, right? That provides that level of exercise for you. But I know what you're saying about the water aerobics. It's quite challenging and it can be a
Yeah.
great cardio and great strengthening exercise. Yeah.
But thanks.
Totally. Yeah.
Thank you for sharing, Miss Celeste. I love it. Again, yes, I think, I agree with your change. It's very tempting. So, you're not alone in that. So we believe in you. We got Louise and then Miss Doris and then Miss Betty. I think we had another hand, but anyone else would love to share, raise your hands. Hey, Louise.
Yeah, hello. This has been so good. I used to come downstairs in the morning and I don't go back until like 8:30 to 9 at night. But I move around. I do the classes, or classes. But I get up every 30 minutes, even if I just walk to the kitchen and I open the door. I need to do more walking in the neighborhood. But I'm afraid if I'm alone, I have to use a cane and I'm not very stable because this Parkinson's story can make you shake, you know. So sometimes I would walk from the first floor to the basement, to the laundry room by holding on to the rails. It's just that I want to get the exercise in.
Mm-hmm.
And if I come down and don't go up, I have to find something to do throughout the day to keep me going. Because I remember my right knee was very stiff, I couldn't bend it. And after I start doing that, I can stretch it out and I can bend it and it doesn't hurt anymore. So there's something working. And one thing I do in the early morning is use the ball on my bed, the big ball, by going forward and backward and sideways for my shoulders. And then I do the knee, I pull the knee up to the chest also, like 10 times for each leg. And it really helps. It makes a difference. And do the shoulders, rotate the shoulders back and forth. And so, but I need to go outside more.
Well, thank you for sharing. Yeah, it sounds like you're doing a lot. And please don't feel like you should do anything. Like if you don't feel safe going outside, you don't
Yeah.
you don't need to be, there's no mandate you need to go outside. It sounds like you're doing a lot in your house.
Yes.
And if you don't feel comfortable and definitely if you have a buddy that you can walk with, that would be ideal. But don't force yourself to do something you're not comfortable with. That's okay. It sounds like you're doing a
Yeah.
lot.
And I make a bathroom on my first floor. I took a piece of my living room and make an extra bathroom. So I'm on the same floor and I don't have to run upstairs or downstairs. That's dangerous.
Yeah.
If I think it, I go.
Right, that's smart. There's a free, I found out about this recently, and it's not convenient necessarily at the Kennedy Center, but there's a free Parkinson's dance class at the Kennedy Center every week.
Mm.
But I know it's not easy to get to, but
I tried to dance, but I keep tripping over my foot.
yeah.
Yeah,
Well,
one
that's
get caught behind each other, and your brain is saying step sideways, and you're looking and saying I should be going one direction. It's sometimes you got to sit there for a few minutes And my family members say, "What are you waiting for?" I say, "Waiting for my leg."
Yeah, my mother says that now too. Yeah. Just
Yeah.
let my legs get, yep. Yep. Because they're getting the blood flow and the signal. That's okay.
Mhm.
Yep. Thank you.
Thank you so much.
Mhm.
Thank you, Louise, for sharing. Again, any new changes that you will make as a result of the session today, we love to hear how this session has impacted you. Any new changes, something new or something that you'll do more. We got Ms. Doris next. Thank you.
Again, I like to dance. So that exercise I do all the time. I love dancing and I love doing the chair exercises. And the doctor suggested me what she was just saying about, going outside and walking. He said you can walk through your house, during the day back and forth to your house.
Yeah.
And you can get the same result as going outside. So I've been doing that one too, which I'm glad of that one because all neighborhoods aren't safe. So
Right.
I do a walking, in my home. And I need to get back on the treadmill because I have a treadmill, but I haven't used it for a while. So
Yeah.
those are the things I want to improve on.
Sounds good. Yeah. Yeah. Of course. Just increasing your activity in your home is totally fine. Yeah. If you don't feel comfortable outside, don't force yourself to go on your own. That's, also be mindful and be aware of what you're comfortable with and what's safe for you.
Uh-huh.
Yeah, you can walk many laps around your house.
Yeah, that's what I've been doing.
Mm-hmm.
And the other thing is, I have to be more consistent with it and not do it when I feel like doing it.
Yeah, that's the hard part.
Yeah.
That's why all my exercise equipment is there, because when I turn the TV on at night, I'm like, it's right in my face, and I'm like, all right, like I'll do it while I'm watching TV, which is generally what I do. So,
So thank you for sharing. I enjoyed this session.
no, thank you.
Thank you, Ms. Doris. You got this. Consistency is the key. A little bit each day, something, a set amount of time each day, not 7 days a week, right? Rest and all that stuff. But, if you do it consistently each week, you will see the results. Just like with anything in life, consistency really does help. Well, I love all of your questions and your comments, you guys. Your guys are definitely inspiring. Any new changes, any new things that you'll do, or something more that you'll do as a result of our session today? We got Miss Betty, then Miss Ann, and then our other Ann. Miss Betty, are you there? You unmuted yourself.
Oh, I'm hi, hello everybody.
Hi.
This has been a very good session for me because it's real hard for me to get motivated. I know I need to do these things, but it's very hard for me to get motivated. My husband is sick now and he's in and out of the hospital, but I'm trying to do around him. Now, just last week, I was talking to one of my neighbors, and downstairs they have an aerobics class that they do, a chair aerobics that they do every Tuesday and every Thursday for an hour. And I joined it last Tuesday. I was only able to do 15 minutes of it because my husband wouldn't have known where I was and if he needed anything. I didn't have him set up, prepared for me to leave the apartment. But at any rate, it was, oh my goodness, it was tiring and it was hurting and I said, but oh, that's all I needed was 15 minutes anyway. I have to work up to it.
Yeah.
I have, what's the dizzy thing?
Vertigo.
Yeah, I have vertigo. And a lot of times I'm down with when I wake up in the morning or when I lay down to throw my legs over the side of the bed, place them on the floor, get myself together, and then stand up. stand up for a minute until I can move out. But
Mhm.
sometimes when I'm fixing something to eat or in the kitchen, it hits me. Now I just need something to grab onto. If not, I'm gonna fall, because of the dizziness. So I have to use the sink and the counters and everything to move around till I can get to a chair
Mhm.
to sit down. So that's what I do with that. That was very helpful to know that I'm doing something good at least for this vertigo issue. And I do walk around my apartment, but only when I'm doing something. If I'm going to the bathroom, I just don't literally walk around, which I'm gonna start getting into because my husband needs to do it.
Great.
So we'll do it together, even if we have to go out in the hallway.
The hallway, yeah. That's the
Yeah, in the
advantage of living
hallway.
in, apartments is nice to have that hallway.
Yeah, and walk. And we do have a gym downstairs, but that stuff is a little hard for me to use, and I dare not get on the walk thing
Right, the treadmill, not with vertigo.
because of the
No, yeah,
vertigo. Yeah,
right,
I dare
exactly. Yeah.
not get on that.
Right,
Right, it's
right.
all
They
about
had
contacting your PCP. You got to call and get in because everyone's individualized. You got to see what they can offer for what you can do to help you. And so
Yeah,
I recommend that just based on what Tori shared today. You got to call and see what's available for you because
yeah,
everyone's
because
a
the
little
chair
different.
exercise is just wonderful. We had the laptop set up, and we were all watching the man in the laptop on what to do. And it was very, very nice. And it's fun because I have my other neighbors, even though I
Yeah,
don't come out of my apartment to
yeah,
socialize too much. I
right,
have them for that hour.
right.
So it's very, very nice. I appreciate you, Tori.
Thank-
This has been wonderful.
Oh, thank you.
Thank you, Miss
And
Betty.
we've got 2 more hands, Alex, and we've got like 7 more minutes before it's 3 o'clock. So we'll have those other 2 hands. Yeah.
Yes, so
One thing
just
I'd
keep.
like, yeah, I would
Oh,
like to say something about what Miss Betty said though. I always feel a little concerned when I talk about how important exercise is that people are going to feel guilty. Right? And that's not what I want you to take from this. If you do 5 minutes of exercise 3 days a week for a couple of weeks, like that's great. It's 5 minutes more than you did last week. And when you start, you'll figure out that when you start carving in just 5 minutes a day for a couple of days a week, then you'll be like, oh, well, I think today I can do 10 minutes, and then I think I can do 15, and work your way up to it. It's not that you have to go from 0 to exercising 30 minutes a day, 5 days a week. I wouldn't recommend that. And you're going to hate it, and you're going to feel bad, and you're going to feel guilty, and none of that's helpful. So just do a little bit, a couple of days a week, and then see how you feel and what you enjoy, and just take it from there. So please don't feel guilty about what you're not doing right now. Just think about something in a more optimistic, what can I do?
yes, what you can do. That's so important. Thank you so much for that, Tori. And then we got Miss Ann for our last comment for today. What new things did you learn or what new changes are you going to make?
Okay, hello everyone. What
Hi.
I learned is exercise increase the blood flow. I have an ankle swelling. Every now and then, before I get up from the bed, I raise my leg. I do a little, like I'm driving bike.
Mhm.
It really helped me, but I'm wondering why is my ankle swollen? I look at my medication. I told my doctor, I said, look, this is what I experience. My ankle swell when I do a little exercise in the bed or you get less. She said, I might have to be on fluid pill, maybe return fluid. What do you have to say about that?
What do I have to? Well, first I would say I'm not a doctor. So
Uh,
So you did the right thing to talk to your doctor because feet swelling can be any number of things that can cause that. So definitely whatever your doctor advises, I would go with that. But additionally, I think what you're doing once you've gotten past that, and if you're on any medications or whatever, could be medication, could be change of diet, but certainly doing exercises to also help manage the fluid is also a good idea. So pumping your ankles up and down, or getting your legs, if you're laying flat, raising your legs up and moving your ankles. And because the fluid, so as as we know, like our heart is here, right? And everything just flows in a big circle, right? To get the fluid from your legs back up to your heart, is your calf muscle is a huge part of that. Right. So pumping and moving your calf muscle and using gravity to help you getting your legs above your head and using your calf muscle is important to get that fluid back out of your feet. But definitely make sure you do whatever your doctor says.
Okay. Thank you so much.
Yeah.
Thank you, Anne. We really appreciate it so much. I wish, we had more time for questions, but, we've had so much fun, time just flies by. So, until next time, we're about to end. But Tori, thank you so much for your session today. I learned so much. Relearned a few things, learned some new things, which is why we love having you return. And I really like that bit about the physical and cognitive health, your brain health. So that just made me think, how do you think, our different sessions that we have here, our technological and provider and our social and our events, how would that, help your cognitive health, and how does good cognitive health turn into good physical health?
Yeah. Oh, you're asking me? Or well, yeah. I mean, you've had sessions, I'm assuming, about cognitive health, right? Have you had people come on and talk about that?
No, I'm talking why for these sessions, why our daily sessions, why do these Zoom sessions, these social sessions, how do they positively affect someone's cognitive health? Like, we've had folks come on our Zooms 2, 3, 4+ years. So how does that positively affect your cognitive health, and then in turn your physical health?
Well, that's a good question. I think that because you have a combination of, sorry, my little dog wants to say hi to everybody. Um, because you have socialization, which is really important. You're learning new things, which is really important as part of brain health. I know some of your sessions about exercise, which is really important about brain health. So anytime that you're still challenging and you're still learning and you're still growing and connecting with people and enjoying and having fun, all of those things are good for your brain and for cognitive health. And just keeping yourself physically active. So I don't know if I answered your question, but I do think that this community that you've developed is amazing. And I hope that you all understand how important it is to continue to participate in this versus being alone and isolated. We know that's not good for your cognitive health at all.
Yes, thank you so much for answering that. I really appreciate that. And it does make us feel good when we have each other, and, we're not alone in this, and we can hear others' experience that may be similar to ours. So I hope today's session encourage you all, not to feel guilty about anything, but just to become a better version of yourself. And you can do that at any age, as Tori said. You could be 8, 18, 80. It doesn't matter. It is a mindset thing, but you got to keep putting positive things and optimistic things in your mind and focus on what you can do versus what you can't do. But certainly your research today was so informative, and it really created a holistic approach, and how you got to think of all of yourself, not just parts, and try to build all of the areas, your physical, emotional, cognitive, spiritual, all of those kinds of different healths and wellness things that we must consider. So thank you, Tori. Well, you'll be with us in about 2 months or so again for another topic, and make sure I'll review this video on our YouTube and stay on for our poll. But thank you again, Tori, for your time today. Thank you all, seniors, for your questions and comments. And let's say goodbye to Tori and her dog for our session today.
Lucy.
And yes, Lucy, let's say goodbye to both of them and thank her so much for our wonderful session.
Thank you,
Thank
Tori.
Thank
You,
you.
Tori.
Thank
Bye
you.
bye. Bye bye,
Yeah.
Tori.
Bye.
Bye,
Thank
bye.
you.
Bye,
Bye,
doggy.
Bye.
Tori.
Thank you. Thank you.
Bye
Thank
bye, doggy.
you. Thank you
Bye,
so
everyone.
much.
Because when I picked up the phone to
Thank
call
you so
Dora,
much.